Hello, my name is Sarmad. I'm going to be making, this is my synovial joint culminating or summative project. I'm going to be making the knee joint today, which is a synovial joint in the leg. It connects two parts of the legs, which is the lower and upper above and below the knee, because the knee is a joint. Below the knee is two bones called the tibia and the fibula, and above the knee is the femur bone, which is the largest bone in the body. Of course, these are not going to be completely to scale as to what the actual sizes of the bones are, but I'm going to try my best to show the difference in sizes, using the newspaper, for example, to show that the fibula is significantly smaller than the tibia. And I'm going to be using these balls to show the ball and socket nature of the knee joint. And I can use the newspaper again to show the concave kind of structure that connects the two around the knee. And then I'm going to be using these rubber bands, which can show the different ligaments and tendons in the knee. And then I will also be explaining some injuries that can take place in the knee once something is ripped, for example. So now that I have finished the general structure of the femur, as well as kind of the general structure of the tibia and fibula, which I'll be attaching on later, these are going to be the gloves that I was using before, are going to be representing kind of like the menisci. So the two meniscuses, which are at the top of the tibia and fibula, and when they are in the human body, they kind of resist any rubbing or any friction between them two. And then again, this whole area is coated with synovial fluid, so there's a synovial sac that encompasses this whole thing, and it keeps it lubricated and prevents it from rubbing too much together. So again, just to go through my knee joint again, so this is a finished product without the labels. I have yet to label it, but this is a knee joint. The knee joint is a synovial joint. It is capable of both flexion and extension, but extension is more limited than the flexion. So to start off, the knee joint consists of a few bones. There's the femur at the top, which is at the top here, and this is the posterior side, this is the anterior side. So this is the femur, and at the bottom we have the tibia, and the small bone at the side is the fibula. We also have the patella here, which is this cardboard kind of piece here, which would be moving around, as you can see a little bit, because it's going to be contained in a synovial sac, which has synovial fluid in it. Then at the front here, we have a few ligaments. There's the quadriceps ligament, as well as the patellar ligament. At the side here, we also have some ligaments, which stabilize the knee joint, as well as the patella. So the knee joint is a very commonly used joint. It can be used in kicking balls and sports and such, and it can also be used in running. It is an essential part of also walking. So if we look at some injuries that are available or are common with the knee joint, if I remove the patella just a little bit, you can see here this this purple rubber band here. This is the anterior cruciate ligament, or the ACL. This is a very common injury area for a lot of athletes. So again, if I just kind of separate these two, you can see the femur at the top part, which I'm shaking now, and then the tibia and the fibula at the bottom part, which I'm shaking now. So because it is kind of like a ball and socket connection here, there's the femur has a convex kind of shape, and it connects into the concave socket of the tibia and fibula. However, it's not a ball and socket joint because it's very limited in its flexion from side to side. It's mostly flexion and extension. So if I just put my patella back on. So if we just examine the femur a little bit more, if I pull my patella down a little bit. So this is, if I am standing right now, this would be my left leg, because the fibula is always on the lateral side of the tibia. So this, as I was saying, like the convex kind of circular projection of the femur, this side would be called the lateral condyle. This would be the medial condyle of the femur. And again, so it would be extending from the quadriceps muscle, which is here, there's the vastus muscles here, the quadriceps, and it would come down, and this would be attached to the patella separately. So it would be two different tendons, which are these green ones here, rather than just one as I've shown. But it would be kind of blended. So the first one would be the quadriceps tendon, and it would connect on top of the patella like this, and it would stop, and then a few centimeters down it would start the patellar tendon, which connects the patella to the tibia here. At the side, we have another 2 ligaments which connect the femur and the tibia both laterally and medially. These are again meant to stabilize the knee. And just to recap, the most common injuries come from physical blows either to the side, so the lateral or medial ends of the knee. It can also happen when you land on the joint kind of funny or what have you, but what usually happens is once you're kicked or something on the side, as I was saying before, it's either usually flexion or extension. Medial or lateral movement is very limited in the knee. So once it does get too much, this ACL in here can be torn or ripped, or these ligaments can be damaged, or the patellar ligaments or the quadriceps ligaments can be ripped or what have you. It depends on the severity of the injury, but most likely there's a lot of surgeries involved with knee tears, such as the ACL repair surgeries, which are very common. So if we just take a look here, so obviously the patella is not as flat as I've made it to be. It's kind of like a 3D shape. So this groove here, in between the 2 condyles of the femur, between the 2 circular projections, this is called the patellofemoral groove. So this here is where the patella would kind of fit in. And so if I just use my example of this blue film as I represent the synovial fluid and the synovial sac, this would be encased in synovial fluid, which would make it lubricated, so it would be able to move and extend the patella more easily than what if it was not lubricated. So if I just remove that again. So again, this is the medial side of the leg. So this ligament here, which connects the femur to the tibia, is called the lateral collateral ligament. And on this side, so this again connects the femur to the tibia. This is called the medial collateral ligament because it's more towards the midline of the body. So again, this is a very limited joint. It's not a synovial joint which can have free movement like the shoulder is, so it's not a ball and socket completely. It's only ball and socket, I say, in the sense that it's a convex projection from the femur to a concave kind of area of the tibia, so it's able to flex and extend most usually, I guess. But it can also, it's limited, but it is also possible for it to do some medial and lateral movement, but too much, again, can cause damage to the human body. Thank you so much for watching my presentation.